In 2018, medical device manufacturer Medtronic was forced to recall their MiniMed insulin pump. The reason for this recall was the cybersecurity risk that hackers might be able to control the pump's remote control, which could include over-delivering insulin to a patient, causing low blood sugar, or stop insulin delivery altogether, potentially killing them. The risk of hackers potentially controlling a medical device and even killing a patient underscores an important question. How can companies and their respective entrepreneurs prevent or at least minimize the likelihood of a serious malfunction from occurring? It is this concept of risk mitigation and safety measures that the Aplos team will address in today's video. First and foremost, since we do not work with Medtronic, it might seem counterintuitive to produce a video discussing their potential safety practices, but the reason is simple. First, as Aplos mentioned in a previous video, safety measures and regulatory compliance go hand in hand. You cannot get regulatory approval without first demonstrating that your product is safe, and the way you demonstrate your product's safety is specific safety measures. But beyond that, we want to show actual examples of both safety measures and regulatory compliance and how the two intersect in the real world. So, let's get started. To be perfectly candid, the Aplos team does not specialize in cybersecurity or information technology, so we can only speculate on what Medtronic might or will do to minimize the likelihood of a cyber attack on one of their medical devices. First, Medtronic should probably create a cybersecurity team to help prevent, detect, and respond to cyber threats targeting their systems and products. That said, they should realize that their core competence is medical devices and not cybersecurity, meaning they might want to hire cybersecurity firms whose core focus is to protect devices from cyber vulnerabilities. However, as Medtronic designs and markets these products, they are ultimately responsible for its safety. They can certainly hire others to assist them, but they bear ultimate responsibility, meaning they must implement their own compliance and development plan to meet regulatory requirements and respond to any potential cyber mishaps. And as we discussed in a previous video about lawyers and regulatory compliance, they will also need to hire outside legal counsel who can help with drafting and implementing policies, as well as representing Medtronic in any dealings with regulatory authorities. Finally, how does a discussion of Medtronic's products and various potential safety measures have anything to do with getting regulatory clearance for one's products or inventions, which is the focus of the Aplos team? First, safety is paramount, regardless the product or service. Second, companies must anticipate and identify any potential safety issues and take preemptive actions to prevent these problems from occurring. However, that in and of itself is not enough. Inventors and entrepreneurs must test these various safety measures to make sure they actually work and ensure that any potential safeguards do not cause any problems of their own. Finally, companies must get regulatory approval for their products by submitting documentation to the appropriate regulatory authority, which in this case would be the US Food and Drug Administration. So how can the Aplos team assist? Aplos Device Regulatory Consulting UK Limited helps companies interested in getting regulatory clearance for their products, but without the bloated fees and intimidating jargon. We can help with advising clients on material to include in a submission, reviewing submissions, doing a gap analysis, and compiling regulatory documentation from scratch as well as more. We explain clearly and concisely so as not to intimidate or overwhelm anyone. From our London-based offices, we work with companies all over the world. Contact us today to learn more about what we do, your needs, and how we might be able to assist. Please let us know too, what questions do you have? What would you like the Aplos team to address? Please also subscribe to this channel if you haven't already, as we are constantly posting more videos. And thank you as always for watching.